Hi, I'm Linda. In this video, I shall explain how inflammation and arthritis work, explore the common types of arthritis, causes and functions. I shall also help you to find which foods are beneficial. But first, I shall explain what is arthritis and why some attack your joints, and some attack your immune system. Firstly, understanding arthritis. Arthritis is a group of over 100 different types of joint-related conditions. The common ones are osteoarthritis, which is wear and tear of the joints. The second is rheumatoid arthritis, which also attacks the joints as well as your immune system. The joint is where two or more bones come together, making you able to move. While medications are often prescribed to you for managing your symptoms, they can give you bad side effects. Unfortunately, arthritis is an incurable disease. The only way you can help your symptoms each day is to do the following. The first one is that you should have a well-balanced diet. You should exercise each day. I know you are already in pain, and you do not want to do exercises, but if you do not, your joints will become stiff and the movement will decrease. I developed osteoarthritis when I fell on some ice in the 1970s, when a curb went across my right knee. I now live with osteoarthritis in my knees, hips, shoulders, and hands. Also, I have a right hip replacement. Rheumatoid arthritis is an autoimmune disease, where the body's immune system mistakenly attacks the synovium. This is the lining of the membrane which surrounds the joints, leading to inflammation and joint damage. It can often affect multiple joints and potentially cause systemic symptoms. This means that if it attacks your left thumb, you will have it in your right thumb. Number 2 is psoriatic arthritis. Is a type of arthritis that occurs in some people who may have a skin condition like psoriasis. Psoriatic arthritis can affect the joints, tendons, and the spine, causing pain and swelling. The third one is ankylosing spondylitis. This type of arthritis mainly affects the spine. It can lead to stiffness and pain in the neck and back and even affect other joints and tendons. Gout is the next one. Yes. Gout, a type of arthritis that causes a buildup of uric acid crystals in the joints, mainly affects the big toe and can lead to sudden severe pain, swelling, and redness. Gout can also attack fingers as well as the toes. And number 5 is osteoarthritis. This one is the most common type. Your joints can wear away from aging, or you could develop this if you have had an accident, as in my case. Risk factor of developing arthritis could be just wearing away of the joints. Or it could be genetics. Some forms of arthritis have a genetic factor. If any of your family has arthritis, then you are at a big risk of developing the condition. Number 3, autoimmune factors. Conditions such as rheumatoid arthritis, where it involves the body's immune system attacking its own tissues. This could be from overuse, trauma, or repetitive joint stress. The symptoms can vary depending on the type. But common signs and symptoms include joint pain, stiffness, swelling, feeling of tenderness, decrease in the range of movement, warmth, or redness in the affected area. When you are having a flare-up, you may feel fatigue and generally feeling of unwell, with a temperature, and generalized aches and pains. Number 1, medications over the counter such as pain relievers, prescription medications, such as disease-modifying drugs. That you must see your doctor if you are taking over-the-counter drugs, as they may interfere with the medication prescribed by your doctor. Number 2, physical therapy. Exercise and physical therapy can help improve joint function, flexibility, and strength, but only do low-impact exercises such as walking, swimming, or cycling. Number 3, lifestyle changes. You should maintain a healthy weight, which may mean that you should go on a diet if you are overweight. It will protect your joints from further damage such as your weight-bearing joints. Number 4 is assistive devices. These are equipments that can help you around the house and work. They can help with managing your symptoms. You can find your local mobility shop near you. And number 4, in severe cases, joint replacement surgery may be recommended for damaged joints, with artificial ones such as in my case. When you have an inflamed joint, it is the body's defense mechanism against injury. The process is complex and it involves cells signaling molecules to change the blood flow. Inflammation happens because your body is responding to a threat such as a bacterial infection, viruses, or fungi invading the body, or if you have a trauma, when an injury occurs such as a cut, bruise, or fracture. There are two main types of inflammation. One is acute. This is inflammation which is your body's initial and rapid response to an injury or infection. It is short-lived and helps to eliminate the cause of the problem. Common signs include redness, heat, swelling, pain, and loss of function. Or it could be chronic inflammation. This is a persistent low-level response that can last for weeks, months, or even years. Unlike acute inflammation, which can damage healthy tissues and organs, chronic inflammation relates to various diseases including heart disease, diabetes, autoimmune conditions, and certain cancers. The inflammation process has a series of steps, such as Step 1 is the beginning of the inflammation. The body detects a threat. Your immune cells identify invaders or damage and release signaling molecules. Step 2, dilation of blood vessels. This step is when the blood vessels near the affected area widens to increase blood flow. This is done to bring more immune cells, antibodies, and nutrients to the site of injury or infection. Step 3, increased absorbency. This means the blood vessel walls become leakier, allowing immune cells to exit the bloodstream and enter the affected tissue. Step 4, immune cell. White blood cells, such as neutrophils, overwhelm and destroys the invading pathogens. These cells also help clear away damaged tissue. Step 5, tissue repair. At this stage, when the threat is diffused and the body initiates the repair phase, it is done by blasts of a substance called collagen that mends the damaged tissue. Lifestyle choices, including a healthy diet that can significantly influence managing your symptoms. You should be on an anti-inflammatory diet. The key components include fruits and vegetables. These are rich in antioxidants, vitamins, and minerals that can help reduce inflammation. Berries, leafy greens, and colorful vegetables like bell peppers and sweet potatoes. Healthy fats can also help, such as fatty fish like salmon and mackerel, and olive oil, are all packed with omega-3 fatty acids. Whole grains like brown rice and whole wheat provides complex carbohydrates. Spices and herbs like turmeric, ginger, and cinnamon are known for their anti-inflammatory properties. Lean protein. You should choose lean protein sources, like poultry, instead of red meat. Beans and lentils. Probiotics foods, like yogurt and fermented vegetables, can promote a healthy gut. Nuts and seeds, almonds, walnuts, and flax seeds are packed with healthy fats and antioxidants. The anti-inflammatory diet can improve your joint function by decreasing inflammation in the joints, improving mobility, keeping your weight healthy. Dietary choices should never replace prescribed medications. You should keep to your dosages until your doctor says you can reduce the drugs. Inflammation helps your body to heal. It is the body's defense mechanism from an injury or infection. The procedure can become complex, as it includes your cells signaling molecules to change the blood flow. The best way to help these inflammation conditions is to go on an anti-inflammatory diet. Although it is not a cure, it can help your conditions. By choosing foods that reduce inflammation, will help you by reducing the pain, improving joint function, and give you a better quality of life. As with any significant dietary change, it is important to consult with a healthcare professional or registered dietitian, where they can give you a dietary plan tailored to your specific needs. Ultimately, an anti-inflammatory diet offers a path to not just eating for pleasure but eating for healing, making it a powerful tool in the fight against arthritis. It can reduce the risk of other chronic diseases such as heart disease and diabetes, which often accompany arthritis. Reduce inflammation. By choosing anti-inflammatory foods, you can help reduce chronic inflammation. Understanding the nature of inflammation, its types, and its role could be essential to finding the correct cause of your symptoms. I am not a medical professional, and this video is for information only. Always consult your doctor for anything you are worried about. I hope this video has helped, and do not forget to subscribe to my channel and click on the bell to receive notifications when new videos are released.